Next, I would like to welcome Shauna Cronin to the stage from Global Leadership Exchange and Step Care Solutions. Welcome.
Stephanie, it's the first time we've met in person. This is a digital conference. I've never met Stephanie in person, but we've talked a lot, so that gives you a sense of what we're here for. Okay, so I'm going to talk a little bit. I'm from Step Care Solutions. We have a booth. You can go visit it in the interest of time. I'm going to be succinct, but we do large-scale system transformation work in mental health and substance use health systems, and with those that are trying to create well-being for everyone, everywhere, in those ways. This is the thing. Green. Amazing. So I'm going to talk a little bit about systems. So I'm going to take a little bit of a different approach today. So the digital landscape is rapidly evolving. We know that. Organizations in the mental health and substance use health sector are trying to build high impact, hybrid, and digital service delivery models. So what I'm going to talk a little bit about today is an ecosystems approach. How do we think about this? What ways can we think about this? And spoiler alert, if you like to take pictures of slides, take a picture of the third one. So 2 after this, that's all the key messages that you need from today. I've been thinking a lot about philosophy and maybe have an existential crisis, so right now you're going to join me in that space. We're going to talk a little bit about technology. How has it shaped us? How have we shaped technology? Key philosophers in this area have kind of been thinking about this for a long time, since before the Industrial Revolution. So since before AI, since before any digital, they've been thinking about how does technology or the advancement of the machine impact us? How do we impact it? Is it predetermined? Do we have autonomy or agency within this? It's important to think about this has been a long conversation. This isn't just a point in time around transformation. This is a long-standing human evolutionary conversation that we're living at this point in time. So understanding these perspectives is really important. Why is it important? I'm a Star Trek fan. Do I have any other Star Trek fans in the audience? Thank you for being brave enough to raise your hand. Love this. This is the Borg, if anybody doesn't know. Captain Picard? Okay, you can check it out after. Also take a picture of this slide. All this to say that actually we've seen that our values as humans have changed. They've changed because we've engaged with technology and technology has engaged back with us. So what we see here, our privacy and confidentiality values have shifted, as has our philosophy around autonomy. Another really important thing for all of us in this room, and we have people internationally coming here, and also no country is homogenous, is that worldviews are informed by identity. So the way we think about technology, or the way I think about technology and my values associated with it, and therefore what I want technology to do for me, is for me alone. This can look different. These are our paradigms of focus. Our worldviews inform our values, which inform how we feel about the technology we're building, and we must recognize we are not on a homogeneous journey as humans around this piece. So, this is a slide, just so you know. Take an ecosystems philosophy. So, in the interest of measurement-based care and quality improvement, I've actually quality improved this. Please stop building new things. We have a lot of things. We can focus on collaboration. So when we think about system design, we think about collaboration, partnership, that this is the only way forward for us to have comprehensive service delivery, meeting the needs of people, of humans. This is why we do this work, connecting humanity. The other thing is open source learning, please. Share. Share what you know, share what you've learned, share what you've captured. Don't share client data unless you have permission, but share everything else. This cannot and can no longer be a scarcity mindset around competing for funds. We know they're limited. We know the geopolitical context is challenging. We know the socioeconomic context is challenging. We know we're all competing for money. And we have to do better. And we have to be accountable to those that we're serving. Understand the how, not just the what. So as a system designer, I'm very passionate about how we do things, not just what we do. And I want everybody else to be passionate about how you do things too. How we do things matters, and it actually impacts the systems we build, and it actually is important because it allows us to think about de-implementing the parts of the systems that don't work, not just adding on. This is very important when we think about technology. We really like to add on. What are we taking away? The other piece here is that this is about people. At the end of the day, digital transformations are occurring at unprecedented rates. That is change. Change is hard. Change is hard for systems, change is hard for organizations, change is hard for people. We do not like change. We have binary patterns in our brains. It's how we're wired. We can move past it, but we must meet people on the human journey of loss and grief when we change systems and when we introduce new evolutions. I'm going to talk very quickly about a case study. How am I doing, Stephanie? Amazing. Okay, great. I was going to be quick, so I'm going to be quick. So a case study from Step Care Solutions during COVID was Wellness Together Canada. Our CEO, Anne-Marie, spoke about this earlier on the panel. You can learn more about this if you come to our booth, but just in a little bit of a snapshot, we knew that Canadians face significant barriers to mental health care, including long wait times, geographical limitations. We have a lot of rural and remote communities across the country, and administrative hurdles, referrals, health cards. Care was often only available during office hours. Many of you know this. This is what we're trying to solve. These are the problems we're all trying to solve. So the solution was actually a partnership across the country, creating Wellness Together Canada, which was a 24/7 bilingual virtual platform providing a full continuum of care. No referral, no health card needed, no appointment needed. You can see on the final column the impact of what it achieved in a couple of years, right? 4.2 million people served, providing access when 50% of users would have sought help receiving help outside of office hours, and engaging 28% of users who would have taken no action for their health. So we know that there's something important in our value set, in our worldview, in our paradigms around meeting people where they're at with dignity of choice. Digital solutions are part of that choice. We must do a good job. This is where we become accountable. We must be accountable to collectively find the way forward. Wellness Together Canada was stopped, was closed. COVID ends, things shift, priorities shift, governments change. You might ask, what happened? What stepped in? Nothing yet. But a lot of opportunity. Because as we heard from people even earlier and Strongest Families spoke, there's good work happening across our country. That work didn't go away. Thank you, Stephanie. There's good things happening across the world. That work didn't go away. Over the last couple of days, you've probably noticed there's hundreds of things happening. Don't build new things. We're not at a loss for things. What we are at a loss for is partnership, co-design, understanding how to work together, how to incentivize working together, and how having to have large-scale systemic transformation that supports people on a human level through the change we're trying to make. So this is the second part to that story. Wellness Together Canada had an incredible amount of partnership, worked with people across the country in meaningful ways. It leveraged what they already had, leveraged the expertise they already had, leveraged the services they already had. What else it did was it collected information and it learned. Our team learned. And I get to say this right now, but I wasn't even there. So I feel like, you know, the team that was there is in the back and they learned a lot. And the most important thing is that we don't get stuck within the walls of our own organizations, that we're agnostic to organizations, we are agnostic to product monetization, we are deeply invested in impact. And we are deeply invested in what it will functionally take to shift and transform systems for people who use them, myself being one of them. And so here you see co-design with everyone. This is what we're trying to do next. This is the learnings we're trying to take and move forward in that philosophy of partnership. Model to partner. Don't model then partner. Model to partner. Build with partnership in mind. Build a community. There's excellence everywhere. Build with it. Organize existing resources and respond to large-scale articulated needs, but create flexible programming that can be made to purpose. So a small community should be able to benefit from innovations and solutions that has no money to bring to it. They should be able to benefit from your innovations the same way that a well-resourced, product-driven, monetized system can. But understand what the need is globally, respond contextually. It is complicated and it's not, but there's always a way forward in complication and chaos. Always, and that's our role and that's our job. You can see in conclusion here, we want to leverage system design in the age of digital innovation for creating collaborative, connected, adaptable mental health and substance use services together. Iterate, fund, and partner on existing digital solutions. And I'll leave it there. Thank you.
Thanks so much, Shauna.